Hello, thank you for joining my podcast today where I share ideas on how we can improve the different systems in Nigeria and also how we can solve the problems that are currently affecting our nation. So today I'll be discussing on how we can achieve universal healthcare delivery in Nigeria and ideas on how we can form a more sustainable healthcare systems. Currently in Nigeria, there is a significant issue when it comes to the funding and operation of our healthcare system. So there are several challenges that are encountered in the healthcare system, especially if you have worked in the public health system in Nigeria. You find out that it's currently faced with a lot of challenges like understaffing, lack of adequate funding, the brain drain where health professionals are living and the country, and other systemic issues. But when you compare the reality in Nigeria with other countries where the health system is functioning much better, it will be very clear to you that there are certain things that we are doing that is making us pay for it in terms of poor access to healthcare delivery and loss of lives. The current life expectancy in Nigeria is about 60 years or 65 years. That means on average, a person born in Nigeria, life expectancy at birth of a person born in Nigeria today is about 65 years. And that speaks a lot about the conditions, the living conditions in Nigeria, not just the healthcare, but also the standard of living. How can we achieve a more functional and sustainable healthcare system in Nigeria? I had worked in a federal medical hospital before, so I have experience of what the health system is. So you see stories that keep coming of people not seeking healthcare or seeking interventions on time until it's too late. And when you ask them, they will say they don't have money. Or if you work in an emergency, you see people brought in critical conditions and they don't have money to pay for the healthcare service that they need to save their life. And these stories keep coming up day in and day out, including notable people in society coming on social media and asking for money to pay for their healthcare expenses or for surgeries or for whatever that has to do with their healthcare. Why do we keep seeing this in Nigeria? Why do we see our Nollywood veterans coming on social media and asking for money to take care of themselves in the hospital? Why do we keep seeing this story repeat themselves? It's not a rocket science. It's a symptom of a dysfunction in the system, in the healthcare system. So you can easily dismiss it and say they didn't plan for the rainy day, or they were careless, they were reckless, they were financially not smart. But that is a simple answer to the problem that is rampant in the country. You see people coming to the hospital because of lack of access to finance. They don't get the quality healthcare they need. Some of them die. Some of them have life-changing and life-altering, dysfunction or disabilities. which drastically reduces the quality of their life. So how can we transform our healthcare system to a more sustainable model where we stop seeing people coming on social media begging for money to treat themselves? How can we achieve that? All over the world, healthcare systems operate based on their funding model. So the way you fund the healthcare system determines what services are available and what you are able to deliver in the healthcare system. And there are basically 3 or 4 different way you fund healthcare system. And most healthcare system tends to operate a combination of one of these 3 or 4 funding models. Number 1, you can publicly fund your healthcare system through general taxation, right? So the government can provide free healthcare for everybody. And you can see that in places like the UK. You can have paying out of pocket, where you go to the hospital, they give you a bill, and then you withdraw from your pocket and pay, which is the most probably expensive or demanding or the most ineffective way of running a healthcare system, because not everyone will be able to afford paying out of pocket all the time. The third model of funding healthcare system is through health insurance. It can be private health insurance or national insurance, right? Where you contribute money to an insurance on a monthly also basis out of your salary or wages. So when you're sick, you'll be able to benefit from the health insurance. You pay a premium, and then in case of private health insurance, and then when you are sick, the health insurance covers for your medical expenses. So most healthcare system tends to operate a combination of these funding sources. In Nigeria, for instance, most people pay for their healthcare out of pocket. Although you have the government funding healthcare through the public hospitals and clinics, they still ask you for money when you patronize such services. So there is not 100% public funding of hospital per se, and it's more driven by majorly out-of-pocket payment, and then the government play some role. Places like America, the private health insurance have a more stronger role, where most people access healthcare through their private health insurance program. So how do we achieve a more sustainable model of funding? Paying out of pocket is probably the worst type of funding available, and it seems to dominate the healthcare system in Nigeria. Most people pay for their healthcare out of pocket. When you're sick, you go to the private hospital, they treat you, and then you pay for the services from your pocket. But not everyone will be able to afford that. You have to put that in mind. And healthcare is not a privilege, it's a right. Right? So if someone is sick, accessing health services should not be, the right of all the people that can only afford it. No, everyone should be able to access healthcare, and that's what universal health coverage is about. It means ensuring that essential health services, even if they cannot access specialized health services, essential health services are made available, for each and every person, are made accessible to each and every person. That's what universal health coverage is. So the way we can do that, I believe, is the interplay between the public and the private system or sectors. So the government has to play the role, and the private has to play the role. Because of the nature of our economy, it wouldn't be wise to say the government should fund healthcare for more than 200 million Nigeria. It's almost impossible to achieve that. So there have to be a combination of the public and the private system. And private health insurance is something that Nigerians are not well exposed to. like because of our culture or belief, some people believe that why should I be, paying money to a private insurance expecting to be sick? Because of faith, we believe, we shouldn't expect sickness by paying for health insurance. But when life happen, people get maybe accident, or they are diagnosed with a disease they never expected they had, they need money to treat themselves. How can they treat themselves if they are not money, or if they are not economically buoyant? This is the place of private health insurance, right? It helps you fund those treatments that you need, which you cannot afford to pay out of pocket. So the government can play a role in funding the health system, especially for poor and vulnerable population, right? And the private sector can fund through private insurance for the working class and people that are of the working age, or they make monthly income. It can be both the formal and the informal sector. So we have to increase the role of the private sector, which I feel the private health insurance has a more wider role to play. And also the government need to step up in providing healthcare for especially poor and vulnerable populations that cannot afford to pay for health insurance premium. But if you work, whether in the public or the private sector or in the informal sector, earn something every year or every month, you should be able to contribute certain percentage of your income to fund the healthcare system. For example, anytime you go to buy commodities in the market or to eat in the restaurant, you usually pay value added tax. When you do transaction on your phone, they usually collect bank charges. This is some of the way you can raise revenue to fund your healthcare system. Almost everyone that has bank accounts do transaction on maybe a weekly basis, and for almost each of these transactions, you are being charged some amount as fees or transaction fees. When you go to the restaurant to eat, or you go to buy commodities, when you make payment, they give you a receipt. They will say certain percent, whether it's 10% or 7%, is value added tax. What about taking percentage of these revenues and making it available to fund our public health system, especially for the poor and vulnerable population that don't have an income and they can't pay out of pocket? People in the working age, people that earn income both in the formal and informal sector, should be made to have health insurance premium. So there should be a law that mandates that each and every Nigeria that earns above certain amount of money per annum must have private health insurance. So anyone that earns below that can be covered by the public system, but public health insurance system, where the government cover for their health services. But each and everyone that earns above a certain income must have a private insurance premium, and they can choose which private insurance to have, but they have to pay for it, right? Whether deducted directly from their pay, or depending on their employer. The employer can decide to pay for them and provide health insurance for them, or they pay from their salary. But let there be a law that makes everyone in the working age that makes income every month have a health insurance, private health insurance at this stage. And everyone below a certain income, whether they don't earn an income or they earn so little, should have access to the public health services paid by the government, because the government can't pay for everybody. And this is one way you can make healthcare more accessible to everyone. But when you make it so open the resources will be stretched, and the people that actually need it don't get it, right? But if you create a system where people that work and earn something every month contribute a percentage of their salary or wages for a private insurance, and those that don't work or earn below a certain bracket, income bracket, are covered by the public system, I believe everyone will have access to healthcare, because it's not realistic to say the government should pay for healthcare for everyone. The reality is they cannot afford it. So we have to look at these issues and see how we can deal with that. And one way we can achieve that is by having effective record keeping. Record keeping in terms of electronic health records, in terms of identity management, right? To be able to track the income that people make. At this stage of our economy, or at this stage in our country, we should be able to identify people or classify people based on the income they make using their BVN. No matter the number of accounts number you have, each of your account will have the same BVN. So from your account, we should be able to estimate how much you make every month and say, yeah, if you fall into certain income bracket, you automatically don't qualify for the public health insurance system. But if you're above that bracket, the government will pay for your health care. And this is how we can simply solve the crisis we are having in the country. And I hope that what I said makes sense. But if you have any other idea on how you feel that we can fund our system, our healthcare system, to be more sustainable, I'll appreciate it if you write in the comment section. And see you in my next episode. Thank you for listening. Bye.